Knowing how to perform compression-only CPR can save a life. This guide will walk you through the essential steps. Compression-only CPR is a simplified technique that anyone can learn and perform in an emergency, focusing solely on chest compressions. Immediate action can significantly increase a person's chance of survival until emergency help arrives. Don't hesitate to act. Before approaching anyone in distress, always prioritize your safety. Assess the scene for potential dangers. Check for hazards like fire, live electrical wires, or oncoming traffic. Only proceed if the scene is safe. Tap the person's shoulders firmly and shout loudly, "Are you hurt?" This helps determine their consciousness level. If the person remains unresponsive, immediately tell someone nearby to call for emergency help. Look for the rise and fall of the person's chest. Do not check for breathing for more than 10 seconds. Observe carefully for any signs of normal breathing or gasping. This quick assessment is crucial. If the person is not breathing normally or is only gasping, it's time to begin CPR immediately. Compression-only CPR is the recommended method for untrained bystanders and focuses on continuous chest compressions. Kneel beside the person. Place the heel of one hand on the center of their chest. Place your other hand on top and interlace your fingers. Position your shoulders directly over your hands with your elbows straight. Push hard and fast, using your body weight, to a depth of at least 2 inches or 5 centimeters. Maintain a rate of 100 to 120 compressions per minute. Songs like Kelly Clarkson's Heartbeat song have a rhythm that matches this ideal rate. Allow the chest to return to its normal position after each compression. This ensures proper blood flow. Continue hands-only CPR until medical professionals take over or the person shows clear signs of movement. Your consistent effort can make all the difference in sustaining life until advanced medical care arrives. In the United States, Good Samaritan Acts refer to laws that offer legal protection to people who give reasonable assistance to those who are injured, ill, in peril, or otherwise incapacitated. The purpose of these laws is to encourage voluntary aid by removing the fear of being sued for injuries or death that may occur as a result of the assistance. The specific provisions of Good Samaritan laws vary by state, as they are state-governed and not federal. However, some general conditions apply in most jurisdictions. Emergency situation. The aid must be rendered during an emergency. Voluntary care. The rescuer must act voluntarily and not have a pre-existing legal duty to help, such as being a first responder on the job. Good faith. Assistance must be given in good faith, meaning the rescuer acted honestly and without the intent to cause harm. No compensation. The person giving aid must not expect or receive payment. Consent. The victim must consent to the assistance if they are conscious and capable of doing so. If the person is unconscious, consent is implied. No gross negligence. The rescuer is typically protected from ordinary negligence, e.g., breaking a rib while performing CPR, but not from gross negligence or willful misconduct. Formal training resources for CPR and first aid are recommended and include major organizations like the American Heart Association, AHA, the American Red Cross, the National Safety Council, NSC, and other private providers like HSI. These organizations offer in-person, blended, and online courses for healthcare professionals and the general public, covering topics such as adult CPR, infant and child CPR, and various first aid scenarios. To find a course, you can visit the websites of these providers and use their course catalog or find local training centers.